Okay, just to let everybody know, the webinar is now being recorded. So welcome to today's webinar. Today, we're going to be talking about problem solving in supportive housing, supporting consumers through day-to-day crises. So we are Emily Bands, who say we are joined by, we are Emily Bands from the Department of Psychiatric Rehabilitation and Counseling, and I am Dawn Reinhardt Wood, also from the same department. Emily and I work in a couple different projects, and one of them that we're lucky enough to do together is working on the supportive housing learning community for Washington State. So we're very happy to have you here. Next slide, please. So getting through some of the housekeeping, we'd like to welcome you. And today's webinar is hosted by DBHR through the Washington State Healthcare Authority. This is an interactive training. We encourage you to ask questions and participate throughout the session. The slides, as well as a link to the recording of this webinar, will be sent by email after the presentation. You'll receive them from the Healthcare Authority. Also, we want to encourage you, as we said, it's an interactive training. Feel free to type questions, comments, participate in any surveys that we may have in today's webinar. Excuse me, I'm coughing too. So that it's just not us speaking. We love to hear your voice as well, and we think it makes it much more dynamic and helpful. Okay, next slide. Okay. So the first thing we're going to start off with is we want to announce that we are currently participating or leading a study on the learning communities that are being offered to those of you in Washington State by Rutgers University. As you know, for the last few years, well, not few years, quite a few years. I'll just say quite a few. I think maybe since 2018-ish. Since 2018, we've been facilitating online learning communities in a variety of areas. So supported education, supported employment, supportive housing. And so we're seeking feedback from those of you who've attended at least one or more of our trainings so that we can look at, the effectiveness of the trainings and how we can possibly make them even better and meet your needs even better. So as you see here, there's a QR code on the screen. Please use that code to complete a voluntary survey. Again, we're not forcing anyone to do this, designed to gather your input on those learning communities that Rutgers faculty have been facilitating over the past 5 years for Washington's foundational community supports. Specifically, we're looking for your feedback on landlord outreach, buried in treasures, job developers, supported employment supervisors, and supportive housing supervisors learning communities. So if you've been a part of any of them, attended any of them, we really do want that feedback on those areas in addition to the general feedback. And if you'd like more information about this study, you can contact our assistant chair of our department, Nora Barrett, and you see her email is there on the screen. So Emily also dropped the link to the survey in the chat. Hopefully, I don't know that we don't expect them to do that now, right? Do we, Emily? But it is there for you. We ask if you would please help us out by participating in that survey. It's one of the only ways that we have to hear directly from all of you and not just the state level kind of authority folks who, are not just guessing, but kind of guessing and also with some informed, kind of guessing what you need to help you in your jobs and to improve outcomes for the individuals you serve. So please, if you get a moment to take the time to do that, we would appreciate that.
And if you're interested, you can actually save the chat. So if you open up the chat box, if you go next to the little smiley face where you can add an emoji into the dialogue, there will be 3 dots. And if you click on that, you'll see an option to save the chat. So that'll save the chat and that'll have the link. Additionally, as Dawn said, the PowerPoint is going to be sent out. The slide will be in the PowerPoint. So all you have to do is just take your phone and scan the QR code and you should be able to access the survey that way as well.
You can also, next to the link that Emily placed in the chat, there should be one option next to Yeah, so there's like these little dots. And when you click on the three little dots next to that message of the survey link, you can click copy and then just paste that link like into your notes or a Word document or something to save it for you. That's often what I do when I'm in meetings like this or webinars like this. So just another way you can capture that link. Okay, next slide, please. So today's learning objectives, we hope that you'll, by the end of this webinar, be able to identify those day-to-day crises or situations that your service recipients experience that increase their stress level. May also increase yours a little bit. It may increase your frustration levels, your worry, but we're focused on those things that seem to be those day-to-day crises. May not be huge things as we think about huge crises or even crises, period. But those kind of day-to-day situations that increase their stress and they may not have like the tolerance to experience at this point in time. We hope that you'll be able to describe problem solving as a method to support individuals in resolving these day-to-day crises and apply problem solving methods to some case examples.
So when we think about crises, I think it's a good thing to just get on the same page and really think about what that actually means. So when we think of a crisis, we could definitely be referring to somebody experiencing psychiatric symptoms. Somebody could potentially be in like a mental health crisis where they are feeling like they want to hurt themselves or others. But for the purpose of what we're going to talk about today, we're talking about those other crises where the person is having an experience that they're perceiving as putting them in a crisis. So a subjective experience. Some examples that I like to think of is I have one person in particular in mind who I used to work with. I was on call, and this was a man in like his 30s or 40s, but he primarily spoke Spanish. He did not speak English, and he couldn't read in English. And for him, he would enter a crisis around 3 or 4 o'clock in the morning when he would try to read his mail and would realize that he couldn't really read it because he couldn't really read English. And then he would call the on-call phone number. And then we kind of have to talk him through the crisis and get him to de-escalate a little bit because he was feeling so upset and so overwhelmed, right? So when we're thinking about these crises, we're thinking about these situations where maybe the person is experiencing something that is causing them to feel upset, angry, frustrated, overwhelmed. And even if you're not perceiving this as a crisis, it's something that they're perceiving as a crisis. Another really good indicator of this type of situation is whether or not it's impacting the person's ability to use coping skills, resources, and problem solving, right? So when we're working with somebody, and let me know if this is something you've ever experienced, but there have been many situations where I've walked into somebody's apartment to go meet with them and their electricity is off. Or maybe they have no food. Maybe they received a warning or a notice to quit from their landlord. Maybe they got into a fight with a significant other or a friend or a family member, right? And in those moments, the person is feeling so upset, so frustrated, so overwhelmed that they don't know what to do. They don't know how to process. They don't know how to navigate the situation, right? And when those situations occur, and if they're left sort of quote unquote unattended, what can happen is it could then increase, right? And potentially cause somebody to then start experiencing symptoms and kind of snowball from there. Has that ever happened to anybody that you're have worked with, or anybody that you're currently working with where they experience this type of crisis? Almost every day, right? So Lori, many times. Brittany, all the time. Yes, lots of yeses, right? So these things happen, right? And I can give you actually a real life example from today, right? Of something that could have very well put me into my own crisis. I was facilitating a webinar this morning. I went to log into Zoom. My Zoom audio wasn't working. So I couldn't log into Zoom. And I was supposed to be facilitating this webinar. So I ended up having to use some problem solving skills, and I was able to use a different laptop. I was able to fix the computer. Everything was fine, right? But some of the individuals that we're working with, right? And I'm sure you can understand this and empathize with this. When we're feeling overwhelmed, when we're feeling frustrated, when we're feeling all these emotions, it's hard for us to be able to use these skills. It's hard for us to cope and use coping skills to kind of decrease those emotions we're feeling. It's hard for us to kind of come up with a plan and determine resources or use these problem solving skills, right? Dawn put in the chat, lack of cigarettes at 3 a.m. caused a lot of calls to the hotline, often because it was an individual's only coping skill when they felt stressed, right? So when we're thinking about this, the way I'm kind of visualizing it is this experience is happening. This person is now feeling all of these negative emotions, and where some of us might use coping skills, acquire resources, or look at problem solving, some of the individuals that we're working with, or for some of you, many of the individuals you're working with, they're unable to get to that next step, right? Absolutely, David, right? Identifying where the stress is real or imagined, right? Well, and I hear what you're saying, but I do want to challenge that a little bit, right? Because I think the experience is subjective, right? So it's the way that they're perceiving the situation. So even though we might not view the situation as something that is stressful, it is what the person's experiencing, right? And I think something else to consider is that some of the individuals that we're working with might not necessarily have those skills, right? So what we're really going to talk about today, I'm kind of jumping ahead a little bit, but what we're going to talk about today is how we can support individuals to sort of navigate and manage these crises. But before we do that, it is important for us to kind of think about some of these contributing factors, right? And I wanted to add this in because I think sometimes part of our job is trying to anticipate, right? Not assume, because we don't know how someone's necessarily going to react, but we do want to anticipate and just acknowledge and recognize what might be contributing to a person's experience in a crisis. So we're talking about social or familial factors, right? So the person is maybe having issues within their personal relationship. It could be the death of a friend or a family member. It could also be different environmental factors, right? So it could be their living arrangements, or maybe a community event is occurring that is causing some negative emotions and negative feelings. It could be something like a natural disaster, right? Let me know if you feel this way, but I think the pandemic really contributed to a lot of us experiencing a crisis, right? And then there's also emotional and physical health factors, right? So a lot of the individuals I worked with either had physical health issues or developed physical health issues in the amount of time I was working with them. And that could really shift somebody, right? I mean, if you're hearing from your doctor that now you have diabetes or high blood pressure or high cholesterol, and you're having to make all of these changes within your life, that could potentially make you feel overwhelmed and stressed and anxious, et cetera, or increase in mental health symptoms. And I just want to highlight what Jennifer said, right? So for individuals in crisis, in addition to feeling overwhelmed, memory loss, decreased cognition, closed thinking, right? So when we're experiencing all these things, it's hard for us to be able to do something like problem solve or try to navigate the situation. I'm not sure what a DCR is, Amber, but I think it can be challenging because when we think of crisis, I definitely think we imagine that meant, okay, designated crisis responders. Thank you. So those individuals are probably looking for more of that typical mental health crisis. But these type of crises that we're referring to could be a really great opportunity for you all to provide support to the individuals that you're working with. Because I think the designated crisis responders, I'm going to go out on a limb, and please correct me if I'm wrong. But they're probably looking to assess of whether or not the person is a danger to themselves or others. And in some of these situations, that might not necessarily be the case. It may be that the person is unable to, or just doesn't have the skill set to be able to navigate the crisis, right? But that's where you all can come in to provide support to them. And we're going to talk about how. Before we do that, though, I want to get a little bit more details from all of you. So it sounds like people you're working with have been experiencing some of the types of crises that we've talked about. What's caused some of these crises? What's been happening to some of the individuals that you're working with?
So folks are saying things like housing instability, absolutely, repeated trauma like domestic violence, evictions, another DV, another eviction, not taking meds. Yeah, and you know, it seems like folks are really coalescing around the housing, trauma, interpersonal violence, turbulent social structures that follow them into their new housing. Yes, I love that. Long-term homelessness, which probably contributes to that turbulence. Substance use, poor planning on the individual's part. They know that if they call in crisis, they can get what they want today as opposed to later, such as food. I saw you yesterday and you didn't need anything, but today you have no food, right? So that poor planning, which may be a symptom of executive functioning issues, increased substance use, trust issues, I'm guessing, you know, difficulty in forming a therapeutic rapport with their worker, and lack of financial resources. Not a short list.
Not at
So,
all.
and Angela also said that she works with the homeless population, and that stress of having responsibilities coupled with a fear of going back on the streets. We have a lot coming in. Amazing. Yeah.
Anxiety. So hearing a lot of different things, right? So eviction, poor planning, which could be around like executive functioning, financial, lack of finances, using substances, homelessness, resources being lost. I guess, how are the individuals you're working with responding to these crises? What is the, I guess, plan of action in getting them support, or for all of you to support them during these crises? And I think, Amber, you bring up a really good point, and I am definitely not taking it as a judgment at all in terms of lack of day-to-day abilities / life skills, which causes people to feel overwhelmed quickly. Absolutely. You know, the skill set that a person needs when they're in the hospital or when they're unhoused is not the same skill set that they're using when they're living in the community, right? And for individuals who are institutionalized for very, very long periods of time, for individuals who are unhoused for very, very long periods of time, they lose the skills needed, right? So even if they learn the skills when they were adolescents or in their late teens, early 20s, if that repetition is not occurring, if that continued use of the skill is not occurring, it's going to be very, very hard for them to then use that skill in a different setting. If any of you have been through the golden thread of documentation training, this is something myself and my colleagues discuss when we talk about skills training. It can be very, very hard for individuals to go from one setting and be able to transfer the skills or even remember the skills. it sounds like we're getting some other people in the chat. So for you, Corey, you said sometimes it's just meeting people where they're at. For some people, you said, Lori, they're maybe avoiding I guess, trying to resolve the issue. David, for you, it's building trust with that person, using some wraparound services, Keisha. De-escalation is helpful, absolutely. Stephanie, yep. Warm line, crisis line, for if you can't immediately provide support. And yeah, some of them don't know what they need, right? Some of them are unsure how to go through that process of problem solving and really trying to figure out how to resolve the issue. Or maybe it's even about determining what the issue is, right? When I asked you what caused the crisis, most of you, I would say, gave me a lot of very broad issues, right? So a lot of you mentioned eviction, right? But when we're trying to problem solve, and I'm going to talk about this a little later down the line, so I don't want to get too much into it, but when we're talking about problem solving, we want to get specific, right? They were evicted and that's what happened, but why did they get evicted? Did they not pay their rent? Did they have people in their apartment when they shouldn't have had? Were they using substances in their apartment, right? Those are the problems and those are the challenges that you want to support the person to find resolutions to. Jennifer, you said using strengths-based support to outline their strengths and use that to get them motivated. Yeah, oftentimes, sometimes people just need resources, and being empathetic and validating can go a very long way. We're definitely going to talk about that in a minute. Angela, you said identifying barriers, listening absolutely to what they're saying without giving opinions. Sometimes it really is about patience, right? I hear what you're saying, Amber. I don't know if Dawn, if you echo this, right? But as an outreach worker, you said you're constantly triaging, de-escalating, and helping people regulate immediate emotional distress. Absolutely. That was definitely something that I felt I was doing a lot when I was working in the community. And I recognized that a lot of that had to do with lack of skills, right? People just didn't have the skills to regulate themselves. People didn't have the skills to be able to identify a solution, which increased their anxiety. You were going to say something, Dawn?
It makes me laugh. You pay great attention to my mute button. Yeah, I was just going to say, I remember working in supportive housing, not only as a, frontline case manager, but also as a supervisor, then director, and thinking about, certain folks that we were serving, like, wow, everything's a crisis for this person. And just kind of like, being amazed at how difficult it can be and how torturous that must feel to not be able to, have some of the skills to resolve what felt like to us were small issues, but we also knew that if they weren't addressed, in the next few days, maybe we would be calling for a crisis response, right? And we don't want it to go there. So, yeah, I definitely echo those sentiments.
Yeah, and I think sometimes you do have to help the person regulate through that initial crisis where they're feeling those negative emotions, where they're feeling angry or frustrated, upset. And then from there, that's when you can take that next step. So I love what a lot of you are saying, because I think it's very much echoing what I'm going to talk about. So when we're thinking of somebody being in a crisis, the first thing we really want to do is try to resolve that initial conflict. Okay. And really de-escalate. Okay. And when we're doing that, we want to validate, we want to explain, and then we want to problem solve. And it's really important to validate and explain and kind of work through those two steps before you problem solve. And I say that because think about it. If you're feeling stressed, if you're feeling overwhelmed, if you're feeling frustrated, have any of you out there had a issue where maybe you got a flat tire, or maybe you had a negative situation occur with like a friend or a family member, and you're feeling upset, you're feeling frustrated, you're feeling overwhelmed, and you go to talk to someone else about it, and they're just saying, well, you need to do this, or you need to do that, or why don't you try this, or why didn't you try that? Has anyone ever experienced that and then felt even more angry and more upset and more frustrated and more overwhelmed?
Invalidating. It's invalidating in the moment when you feel completely overwhelmed. Yeah.
Yeah, absolutely. Right. So we want to validate, we want to explain, we want, so you know what, Teresa? I didn't want to call out the husbands here, but I echo that. I understand how you feel there. But I think it comes from a place of love, right? It comes from a place of love with our, family members and friends and significant others. It comes from a place of love. It comes from a place of concern. Right? For you as a support worker, you're wanting to help the person resolve the situation, right? Because you care about them. You see them upset, you see them frustrated. Of course, you want to help them, right? So absolutely, right, Stephanie, you want to work at their pace. And I think for anybody who's in that situation where they're feeling this conflict, they're feeling this crisis, you want to start at the first step, which is to validate. Okay. So when you are validating, Candace, we have the opposite here. You're wanting to problem solve for your husband and he's just wanting to vent, right? People want that validation, right? Some people do, some people don't. But when you have somebody in this place of conflict and crisis, you want to validate first. And that really is referring to expressing empathy towards the person by reflecting their feelings, right? So using those counseling micro skills, using that active listening and reflectively responding, and letting them know, hey, I see that this situation must be really upsetting for you. Or wow, you seem really upset and frustrated. Or wow, if I was in your position, I would feel upset at this situation also, right? Letting the person know that you hear them and acknowledging how it is that they're feeling. And this can be really important because when we are validating, we're increasing trust and we're providing that support and care to the person, which is what somebody really needs when they're in a crisis, right? They are in this place where they're feeling unheard of, maybe, or they're feeling in a place where they're feeling distraught or upset, right? So by providing that support and care, we're giving them what they need in that moment to de-escalate. And yeah, absolutely, David, right? We're seeking to understand instead of being understood. I love that. And then we're going to explain. And when we're explaining, we're looking to discuss and explore, we're looking to educate, and then we're also going to validate. Okay, we're just going to keep on validating. Validating is key in these moments of crisis and conflict when individuals are experiencing them, right? So when we're thinking of discussing and exploring, we're trying to determine what factors contributed to the situation. And I like this idea of seeking to understand, David, so I'm going to use it because we want to be curious. We want to try to gather information. We want to ask people like, hey, am I understanding this correctly? It sounds like X, Y, and Z happened. Am I getting that right? We're coming from a place of curiosity and not judgment because we're trying to gather information so that we can better understand the situation. Okay. Once we've gone through this place where we're discussing and exploring, then we can provide a little bit of education, right? So if we're looking at this, and I knew this was going to be something that happened, but if we're looking at this place of like eviction or housing challenges, the person is late paying their rent, right? So we're educating the person by saying, your lease says you can pay up until the 5th of the month without a penalty. But it looks like if you pay after the 5th, there's a late fee, right? So we're letting them know and educating them about their lease and what some of the programmatic rules are. And this can be helpful because, and you let me know if this has been your experience, I think sometimes when I was working with individuals and something like this happened, where maybe they didn't pay something on time, or maybe, they something else occurred, right? It's because the person just genuinely didn't know, right? They didn't know that they couldn't wait until the 15th of the month to pay their rent or to pay their credit card bill, or they didn't realize their credit card bill was due on the 1st and not the 15th. They just thought it was the 15th, right? Sometimes people do need that education on how certain things function, right? Because again, no one's paying their rent if they're unhoused, right? And certain landlords have different rules for certain things. People aren't typically paying rent in a hospital either, or in an institutionalized setting, right? So there are information and skills that the person just doesn't know at that time, and that's okay. And yeah, I definitely think people can, feel ashamed. And I think sometimes when people feel shame, it can often come out as anger, right? And this is where that place of validating their feelings and coming from a place of no judgment can also be really helpful, right? So you're educating the person and you're saying, wow, it looks like your lease says that you can pay up until the 5th without a penalty, but if you pay after the 5th, it does look like there's a late fee. And then validating them and saying like, you're really frustrated. You have to pay the late fee for your rent since you didn't receive your paycheck until the 7th, right? So in this scenario, they're receiving their paycheck on the 7th, but it's at a loss to them because now they have to pay a late fee because their rent was due 2 days before. Right? So we want to very gently, very kindly help the person to kind of explore what happened, figure it out, get some of these details, provide education when and where you can, and then validate. And I do want to ask Dawn if there's anything you think I missed, or if there's anything to add here.
I do not think so.
Okay. And then finally, then we can problem solve. Okay. So we've validated, we've explained, and now we can problem solve. And in problem solving, we're exploring and discussing possible solutions to the issue. So again, this is an open conversation. Okay. And I say that, and I really want to highlight that because I think sometimes we have our own method and we have our own way about doing things. But sometimes there's a lot of really great ways to solve a problem. There's not just one. So you do want to explore and discuss any possible solutions to the issue, and really look at meeting the person's needs and figuring out what it is they do need. You also want to use open-ended questions to explore possible options and outcomes, right? So using those probing questions of, well, what do you think would happen if you chose to, ask your landlord if you can have a 2-day extension? How do you think your landlord might respond or react? Or tell me about, how it might look if you asked your employer to, process your paycheck by the 5th of the month instead of the 7th. And absolutely, right, Jennifer, sometimes you have to also reality test them, right? So sometimes the solution that the person comes up with might not be based in reality, or might not be something that's possible or something that's achievable. And this is where this conversation can come in, right? And really exploring with them why it may or may not be something that can work. Okay. And before we keep moving, and go to our method of problem solving that I want to go over, I want to just get some more feedback from you all. So when we're thinking of this idea of problem solving, how do you all actually problem solve with your clients? What's your process? Do you sit down and write things down? Are you just having a verbal conversation? You know, what is your process for problem solving with individuals? Do you have a process for problem solving, or is it more just that feeling of like triaging or trying to put fires out? Okay, so Candace, you said it depends on the client. Um, so David, you said meet the initial need, then they become open to talk. Alonzo, for you, it's the first step, it looks like, is recognizing there is a problem. I got you, David, right? Food, hot water, or food, water, and hot chocolate. And did you say hot chocolate or just chocolate? Food, water, hot chocolate, right? So getting the person's immediate needs met, right? Do they need to use the restroom? Did they just walk 17 miles and they need something to drink or they need something to eat? So Stephanie, you said depends on the client. You ask them what they think the problem is and work from there. Amber, you use motivational interviewing. The client most times already knows what they need to do. Okay. So Cami, you're using a personalized approach and trying to take into account who you're working with, as some might need more support in certain areas than others. Absolutely. I think a lot of you are kind of saying it really depends on the client, and it's a very much case by case situation. And also being direct. What do you asking the client? What do you feel is your biggest barrier at this moment? I love that question. Sometimes it's walking with them through the problem the first time, and then they can, I guess, go on and resolve it. Talking about the issue. Sometimes they can come up with a few ideas to try, or why they shouldn't be doing something that got them where they are. Going back to what you said earlier, David, right? Developing that trust. I want to say it's Venice, but let me know if I said that incorrectly. But for you, you're discussing what's going on, then processing what they need to do, listening to the client, validating, figuring out how to move forward, case by case, using a verbal conversation, doing some de-escalation, just simply asking, how can I help you? Talking it out usually helps a lot for clients. And then making sure you understand, repeat it, and ask them if you got it right. What have you done thus far? Absolutely, Jennifer. Thank you. So I'm getting the impression then from some of the things you guys mentioned in the chat that you're not using a specific method to problem solve. If you're not using a specific method, let me know in the chat by saying no. If you are, say yes, and then let us know what it is. So I wouldn't say, so motivational interviewing is not inherently a method of problem solving. It's definitely great communication techniques, but it's not necessarily what I'm referring to in this situation. Okay. So the next thing I want to ask is, prior to a problem occurring, are you teaching problem solving as a skill to individuals? Is problem solving a skill that you're teaching as like an intervention on their treatment plan? Okay. So Stephanie, somewhat, you're kind of going through this process of working through it and then like letting them know, hey, we just solved the problem. Okay, so Keisha, yes, you emphasize it as you're not with them all the time and they need to figure out what to do or who to contact. Absolutely. And the last question I have for all of you is, do you think that the individuals you're working with might benefit from learning how to problem solve, or in having a specific method to problem solve? Awesome. And I bring this up because problem solving really is a skill. I think for a lot of us, we were maybe taught intentionally or unintentionally how to problem solve. So it's something that we can do without, giving it a second thought. But for, again, some of the individuals that we're working with, it can be challenging because of their maybe because of their lack of skills in other areas, right? If somebody is experiencing challenges with regulating their emotions, right, it's very hard to then problem solve because they're not able to regulate those emotions, right? So something that I always recommend to individuals is if you have people that you're working with that are constantly in these types of crises, it might be worth it to spend a little bit of time teaching problem solving as a skill. And again, I'm going to give you guys a method, and I'm going to recommend a book that potentially your agency could purchase that could help your individuals to learn this as a skill. Because if they're consistently in a place where they're experiencing these crises, they're lacking a skill in that area, right? So putting this on a treatment plan, helping them to learn this method and be able to use it independently, that will then help them to learn this skill. All right, so let's move into the method. Before we do that, though, I want to jump to the end. And I just want to highlight that this is from the text Cognitive Behavioral Social Skills Training for Schizophrenia, a practical treatment guide. Okay. So it's this reference right here, Grandholm, McQuaid, and Holden. They developed a manual on cognitive behavioral social skills training. There's a lot of really great information in here, but they have a specific method for skills training around problem solving. There's a worksheet that they have in the book. I can't really disseminate it because it's in the textbook. But if you purchase the textbook, you should be able to have access to this worksheet. And using the worksheet could potentially be more helpful for individuals. I do think, though, if you go through the steps of this process with the person, it could also be beneficial for them. But when we're problem solving, this method is called SCALE. And before I get into it, has anybody ever heard of this before? Has anybody ever heard of this textbook before? I hate that you're saying no, but I'm happy that I get to share new information with all of you. Okay, so we're going to talk about SCALE. Okay, and SCALE looks at 5 different steps where we're focusing on, we're going to specify, we're going to consider all possible solutions, we're going to assess the best solution, you're going to lay out a plan, and then you're going to execute and evaluate. Okay, and these are the 5 steps that you can teach to the individuals that you're working with how to problem solve in the moment. Okay, so we're problem solving with SCALE. The first piece of this is to specify. Okay, so we want to first identify what the problem is. Okay, so when we do that, we're going to gather information to narrow down what exactly the problem is. And we kind of talked about this a little bit a couple of slides back, where we're using those open-ended questions to explore possible options and outcomes. And this is what we're going to do. So Angela, really quick, are you talking about general problem solving worksheets, or are you talking about this specific method? Either or is okay. I'm just curious. I'll give you a second to answer. But I will say, though, having a structured way of teaching a skill, it's not helpful to everybody, but it can be helpful for a lot of people. So using a worksheet, using a guide, there are many, many methods of problem solving out there. But I wanted to use this one specifically because it's based in cognitive behavioral thought, and it's we use this text in other trainings. So I'm impartial to this textbook, but having some type of worksheet, having some type of method to problem solve can be very, very helpful. So I'm all for whatever is out there. Okay. So what I wanted to do is I wanted to use this method of problem solving kind of in vivo. So I want to ask everybody to put in the chat, let's use this method to solve a problem together. Okay. So to do that, first we have to identify what that problem is. So put in the chat a problem that you're currently, a problem that one of the individuals you're working with is currently experiencing. Okay. Put that in the chat. All right, so Candace, you said lost another cell phone and can't afford a new one. Lisa, high anxiety. Keisha, unwanted people at their rental home. Eviction. Has a HUD voucher but no landlord. Will take her due to previous evictions. OCD issues. All right, so we have a couple of people in the chat who wrote things. Let's try to narrow this down a little bit. Issues. Dawn, I'm going to have you pick. What is going to be our problem?
Ooh, let's see. Yeah, I like this voucher with zero income.
Okay. All right. So where is that? I gotta find it. Eviction with no income. Okay.
Or rental voucher with no income. So, you know, they may have a voucher, but
Okay.
they have zero income.
All right. So let's say rental voucher with no income. Okay. So I put that in the chat. That's going to be our problem. Okay. So the person has a voucher. They can afford an apartment, right? They can look for one, but they don't have any income. Okay. So this is the problem. They need housing. They have a voucher, but there's no income. We now want to frame this as a question. Okay. So the example that I'm giving you is this person is saying, I pay my rent late every month, right? But to frame this as a question, we're looking at as how can I save enough money to pay my rent on time? Okay. So how can we look at this situation where maybe the person has a rental voucher and they don't have any income, but they need to find housing? How can we reframe this into a question? We're going to put our thinking caps on. So for the purpose of this exercise, we'll say that yes, the person can work. Ooh, I like this question, Candace. So Candace said, how will you pay your share of rent? And so when we're thinking of this question, we want to put this in the first person. Okay. We're going to imagine it as if the person is saying it, right? And when you're going through this process with the person, you also want to encourage them to really think of it as themselves. Okay. So I'm going to rephrase some of these questions. So for Candace, you said, how will I pay my share of the rent? For your question, Jennifer, that might sound something like, how will I increase my income? I'm going to write, let me write these down. Okay. So how will I pay my share of the rent? How will I increase my income? Um, how can I apply for a work housing related program? How do I find the minimum amount of what I need to pay toward rent? How do I find an apartment that will take my voucher? How do I know what type of housing voucher I have? You guys are putting really, really great questions. I have a couple here in the chat, so I just want to highlight them. Okay, so the first question that Candace asked, you said, how will you pay your share of the rent, right? So this kind of translated to, how will I pay my share of the rent? And if you notice, I'm using the word how. And I think I think we want to stick with how, because when we're asking what do I need? That sounds like we're just fine. We like almost like we know that information, right? So what type of voucher would it be, right? If you asked the person what type of voucher it would be, they would say potentially say, I don't know, right? But when we're asking, how do I know what type of voucher I have? We're going into this frame of mind where we're, again, trying to find information. We're trying to figure out what we need to do in order to get there, if that makes sense. It's nuanced, but does that kind of make sense? Yes, absolutely, Angela, right? The word how can kind of make it feel like there's options, right? It's more of an exploratory process. Whereas I feel like when we're saying what, it's very focused on maybe finding that specific answer. So I think, I'm getting into the weeds here, and I understand that, so please forgive me. But I do think it's worth it to kind of be mindful of that nuance and really try to focus on that aspect of how can we do it, okay? So we have a couple of really good questions here in terms of, how will I pay my share of rent? How will I increase my income? How can I apply for a work housing related program? How do I find the minimum amount of what I need to pay towards rent? How do I find an apartment that will take my voucher? How do I know what type of housing voucher I have? So Dawn, you're up again here. How are we going to frame this as a question?
Yeah, well, you stumped me because I was multitasking. Can you repeat?
Sure, I can. So I'm gonna retype the questions into the chat. So we need oh no, that's the survey link. My goodness.
Okay, so how can I pay my share of rent? How will I
Yes.
increase my income? How can I apply, right? So yeah, so I see other people saying things like, well, when you've had to have financial commitments in the past, how did you do that? So what are ways in which you think, what are practices you've used in the past when you've had financial commitments?
Oh, I like that. Okay. So maybe how have I resolved this in the past?
How have I resolved, kind of financial crises in the past, and kind of start, and maybe the person never has. Maybe the person has never been, in the position to have to pay their bills, or, even if it didn't work out so well in the past, perhaps we can learn from what didn't happen or what, skills were lacking.
Okay, so I'm going to say, how can I resolve this financial crisis? With the note of, how have I resolved it in the past? Because I think that's a really good question to keep in mind, right?
Or even how have I addressed it in the past? And it might not be very positive, right? So sometimes we can learn from avoiding doing what we have done in the past. I know I've learned that as a, from going from young adult to middle age. Like, I thought in my young adult years that credit cards were like these magic things and that you would just never have to pay the bill. We learn over time how to manage that. So I kind of learned from messing up how to better manage.
Right. And I think this very much leads into our second step here, which is to consider all possible solutions, right? So we're going to generate a list of solutions. And I think a really good way to figure out some of these solutions is, how have you navigated this in the past? How have you tried to resolve this in the past? And absolutely, Amber, right? Natural consequences are important teachers, right? So when we're considering all possible solutions, and we're generating this list of solutions, we want to make this a comprehensive list. Okay, so we want to think about, how have they resolved it, or how have they navigated this in the past? Maybe another great question is ask is, do you know anybody that's been in this experience, right? How have they navigated this experience? And the big piece of this is, we want to list solutions regardless of whether they may or may not work. Okay. And that's huge, because in the next step, we're going to assess and find and kind of determine the best solution. But we don't want to do that yet. We just want to put it on paper and list everything. And for those of you who have been through the golden thread of documentation training, this is a very similar mindset to what we teach when we teach about the knowledge, skills, and resources form. If you don't know what I'm talking about, that's okay. But when we're assessing someone's knowledge, skills, and resources, we're looking at all the knowledge, skills, and resources they have, all the ones they don't have, what they need. We're just looking at everything. We're looking at all the knowledge, skills, and resources that someone would need to have to achieve this goal. Okay. So in the same way, we're just looking at all the possible solutions for this, regardless of whether or not they may or may not work. Okay. And yes, these are really great questions, Jennifer, right? So figuring out, right, who's their support system? Who's the first person that they could call in order to get support, right? That could potentially help them to solve and kind of find a solution to this problem, right? So if we look at this idea of how can I resolve this financial crisis, right? We're thinking about maybe people, right? Is there anybody that could potentially not necessarily provide them financial support, but maybe it's someone who can help them find a job. Maybe it's about referring them to like career services or supported employment services. Maybe it's, they know a friend of a friend of a friend who has a business that just opened and is looking for new employees. Right? And exactly, absolutely, Jennifer, right? What would it look like if you asked them to help you? How might they respond, right? So once we've kind of come up, so I want to actually stick with this example. So if we're thinking about how can I resolve this financial crisis, okay? So we know the person has a voucher, but they don't have an income, okay? And we're going to go on the limb here and say that they can work. They do need to have some type of income though, okay? Because even though they can pay for their housing, they still need food, they still need clothing, they need a bed, they need all of these things, right? So what are some solutions for this problem? For all of you individuals out there that work in housing, right? What are some solutions to resolve the person, to help that, blah, blah, blah. I'm gonna take it back a second. What are solutions to this problem? Okay, the person has a voucher, but no income. What are some solutions? And I'm going to stop talking now because I'm just putting it all out there. We'll give everybody a second to type. So absolutely, Joseph, right? Working a part-time job, right? So maybe part one solution is for them to find a job. Absolutely. What else do we have?
I like that, Meg. And so to help them look into resources that can initially help them move in and then continue to problem solve around solutions such as work. That's great. Rapid rehousing. Yeah. Do they want to work? If so, take them to work source. Do they qualify for additional, benefits perhaps in the beginning?
And
Right.
to those questions, Stephanie, I would save those questions for the next slide when we get to assessing the solution, right? So right now, right, we're taking them to work source. Right now, we're connecting them with SSI or SSDI, right? Those are all possible solutions. Sorry, Dawn. I didn't mean to cut you off.
You're absolutely fine. David said they need to get into a program that helps them individually and prospectively, how to manage your finances while learning a trade while in supportive housing. Right. So it's not just this, one-time fix. That whole act saying, if you give a man a fish, he'll eat once. If you teach a man to fish, or a woman, let's keep it, all things equitable. If you teach a person to fish, they'll eat for a lifetime, right? So like not just coming up with that quick solution.
Absolutely. And then Lori, you said contacting housing authority and doing a change of circumstance, assist in finding employment, finding immediate resources, right? And that could be SSI, SSDI. It could be applying for a SNAP program. Maybe it's registering for local food pantries. In New Jersey, we have to, individuals have to register for them. I don't know if that's what it's like in Washington State.
The other thing, things that can help with utility payments, like in New Jersey, not sure what it's called in Washington, maybe the same thing. We have something called LIHEAP, which is a low income, I think, energy assistance program. It's not just heating. It also, it might be heating and electricity. I'm not sure, because it also helps people who need air conditioning because of certain medications or conditions that they have. So, finding all of those available resources also, in addition to perhaps thinking and absolutely thinking about work if the person wants to and is capable.
And all of these are really great solutions that all apply to this one problem. And I want to highlight that for a second, because we're going in a bunch of different areas here, or it might feel like we're going in a bunch of different areas, but they all funnel back to this one problem that we identified, and all of them could be right. And I say that because now, once we are assessing the best solution, right, we're going to review them all. And this is where we're going to ask some of those questions. This is where we're going to ask, well, do you want to work, right? We put down on this paper that getting a part-time job might be an option, but do you see yourself working? We put SSI or SSDI or LIHEAP, which I hope I said that right. But do you qualify? Do you know if you qualify for these types of resources? Right? We're going to review these solutions, and then we're going to assess the pros and cons of each. Okay. And when we're assessing the pros and cons of each, something that we can do is really think about, what is even a long-term versus a short-term solution, right? And I want to highlight that because I think it was David that brought up that point of like, well, and a lot of you, I think, have mentioned, like, some people are continuously experiencing eviction, right? So something is happening in these situations where this is occurring, right? So we want to focus on, well, maybe some of those short-term things like getting access to resources and maybe getting a part-time job, right? But maybe part of it is now finding like an education program that they qualify for, or getting into a trade program, like I think you mentioned, David, right? So we're going to assess the pros and cons, and something to also assess is whether or not this is something that's going to help in the short term and whether or not this is going to help in the long term. And then finally, you want to order the list of solutions, and you want to prioritize the best 2 to 3 solutions for the problem. Okay. And this is where, again, I want to highlight that some problems have multiple solutions. Okay. And, it's important to look at a few solutions because you might have different areas that need to be targeted. If we look at our example, we're looking at work, right, to help prevent future eviction and to kind of help with their income. We're looking at a plethora of resources. It sounds like Washington State, which I know this about Washington State, has a ton of really great resources. But then we're also looking at some long-term stuff, right? In terms of like, does the person maybe have skills or need skills? Does the person, want to go into a program where they're learning about finances, maybe, right? Is there a resource within their community that can teach financial literacy, right? So we're looking at the 2 to 3 best solutions, okay? And best, again, is very subjective, okay? So even if you might not think this is the best solution, that's okay. We're really focusing on what is going to be the best solution for that person, okay? And that's where the pros and cons come in. It's going to help the person really figure out what the best solution is for them. And then we're going to lay out a plan, okay? So we identified the problem. We were specific with it. We made it into a question. We considered all of the solutions. Now we have 2 to 3. And now we need a plan in order to fulfill those solutions, okay? And when we're thinking of how to develop this plan, we're really looking at first, what are the steps needed to solve the problem, okay? So we have the solution. What are the steps now, okay? So if we're looking at something like finding a job, right? It looks like WorkSource is a resource you can use to support somebody with finding employment, right? So how do we make that referral to WorkSource? What do we need to do on our end? What do they need to do on their end? Is there referral paperwork that we need to do and fill out? Do they need to have an ID? Do they need to have their income letter? Are there any other types of knowledge, skills, or resources the person needs to apply for WorkSource, right? So do they need to know how to use a computer? Do they need to know how to make a phone call in order to speak to somebody? Do they have the communication skills to be able to have this conversation with the person? So that's beautiful, Stephanie. You just walk in and ask for assistance, right? But that tells me that that person does need communication skills, right? They need to know maybe how to make a request, or they need to know how to be able to ask that question. So yeah, do they need, ID, social security card? What types of identification do they need? If we look at something like, a financial literacy course, maybe, they might need to research, right? They might need to research different programs that might be available to them. Is it a virtual program? Is it an in-person program? Do they have the financials to be able to register for this program? Is there some type of financial assistance they can have to register for this program? If we're looking at things like, eviction, right? Is it that the person, is having issues with maintaining the cleanliness of their apartment? Is it that the person is having trouble with communicating to friends and family that they can no longer live with them? So again, we're coming up with a step-by-step plan, okay? And part of this could also probably like parallel what's happening on the treatment plan, right? If the person's goal on their treatment plan is to stay housed for the next 180 days or so, these are all steps that the person can take in order to do that. Okay. And this is a great way for them to learn how to problem solve, but for you to also stay engaged and keep up with that engagement with the person. Okay. Before I move on to the last step, I just want to ask really quickly, does anybody have any questions about the specifying, the considering all possible solutions, the assessing the best solution, or laying out a plan? Any questions about any of these prior steps? No. All right. So let's get to our last slide then, or our last step, I'll say. So for our last step, we're going to execute and evaluate. Okay. And this is when we're asking some of these questions. We're almost debriefing with the person, right? We really want to take the time to sit down and figure out how things went, right? And it's important to do this when you're problem solving, because you could have what looks like are 2 to 3 really, really great solutions to a problem, and maybe they all don't work so well, right? Maybe a barrier came up that you didn't expect. Maybe there's a step that you didn't know you needed to take, but now you do, right? And this is where some of these questions, these really good evocative questions can come in, right? So did the plan work, right? Did it actually work? Were the predicted steps accurate, right? So you made that list of steps, you figured out what the person actually needed to do. Was it accurate? Were there any additional steps needed? And is there anything that could have potentially been done differently? And then, does another solution need to be tried? Because again, you could have a problem with many, many different types of solutions. And many different almost branches. If we look at a problem as like a tree, right, there could be 15 branches on this tree. So you might need to come up with a few different solutions to resolve this overall problem. And yeah, absolutely, David, right? So you always want to make sure that you're using your assessments and you're kind of meeting the person where they're at and assessing for the symptoms that they're experiencing. But I will say, teaching people the skill of how to problem solve is something that I've seen work really well for individuals. You always want to meet them where they're at and really meet their specific individual needs. It sounds like a lot from the information you guys were giving me, it sounds like there could potentially be some people out there that could benefit from using this type of plan. So as we're wrapping up, I just want to ask for some more just feedback from you guys, right? So what do you guys think of these steps? What are your thoughts on this? Something that could be helpful, something that you could potentially use with individuals? What are you thinking?
You know, one of the things that I like, Emily, about your presentation is offering a structure to the conversation. I always found, I still find, on the rare occasion that I get the privilege to meet with a service participant, that, having that structure going in terms of what I need to discuss, what I need to bring up, is really helpful, especially in a situation that might be emotionally laden or where the person is very, very, stressed out, upset. It helps us regulate our own emotions, right? If we kind of have this systematic way of approaching it.
Absolutely. And yeah, I think that when we're thinking of this sort of unfortunate series of events where something's happening to the person and they're in this crisis and they're experiencing this conflict, you know, going from this place where the person's feeling stressed and frustrated and overwhelmed and almost like the room is spinning, to this place where now you have a concrete way to kind of go about solving and trying to find a resolution to this problem, it can be very grounding for people. It can feel grounding for them because they have this structure back and they kind of can start to feel like there is more control over the situation. I don't think we necessarily talked about this, but I think it's worth it to bring it up. You know, when something happens, when a crisis happens, we feel out of control. 100%. We feel completely out of control. And I'm sure all of you, or at least I know I resonate with this, right? It's so helpful to feel like we're getting that control back and to feel like, yes, there is a solution. There is something that I can do to resolve this. And absolutely, I want to say this right. Dhyasana, I'm going to say. But if I said that wrong, please let me know. I really want to highlight what you said because I think this is a really great comment. Dhyasana. Okay. Dhyasana. Thank you. You said you're still trying to remember that everything you do is client driven, and this gives the client the power to decide for themselves how much of something they want and gives them the ability to choose for themselves when they may not have had that before, right? Teaching people how to problem solve gives them their autonomy back. Period. That's what it does. It gives them the skills and the tools to be able to do this on their own. And that's not to say that, you know, you're going to teach them how to problem solve and they're never going to call you again, because we know that that's not necessarily true, right? But this is going to give them the knowledge and the information to be able to try to potentially resolve some of these problems independently that they're experiencing. And I think this can be very powerful for people. Any final thoughts, John?
So many, but I don't think that I want to get started on them. No, I like the fact that Dhyasana said that, that, you know, as people in helping professions, that's our tendency to want to fix problems, right, for others. We want people to be out of their suffering as quickly as possible. If we perceive them as suffering, we want them to be in their best place, you know, in terms of their wellness. But that sometimes like relinquishing that control that we want to have is difficult. It's difficult because I do believe that very often it comes from a very well-intentioned place. But again, you know, that person is going to learn, and that learning, those skills are going to be ingrained so much more if it is self-directed. And you know, very often people who have a negative outlook on life, who have little hope, often have this thing called external locus of control, right? Like things just happen to me and I just have bad luck, and no matter what I do or try, nothing's ever going to get better because that's just my destiny to suffer, right? So by including somebody into the problem solving and shared decision making, you're starting to return that internal locus of control, that self-direction, that autonomy, and mastery over their future that they feel like they have never had or maybe lost as a consequence of, you know, psychiatric or, you know, other condition. So I think it's a wonderful approach.
Yeah. We're helping people to feel empowered.
Yeah.
And like you said, take back that control. So thank you all so much. If you have any final thoughts, please feel free to put them in the chat, and Dawn and I will definitely acknowledge them. But we just want to say thank you. So we very much appreciate your time, your attention, your participation in today's webinar. I'm happy that you guys found the information to be helpful. I'm hopeful this is something that you guys can teach and add to some of your treatment plans to support people. Before we go, I'm just going to put in the chat box again the survey link. But again, please remember that you can save the chat, as well as once you have the slides, you will be able to use the QR code to take the survey. We're very happy and hoping that we'll hear from you. We also want to thank DBHR through the Washington Healthcare Authority for continuing to host these webinars. We're hoping that they provide helpful information to all of you. Again, I do just want to remind you that the slides, a link to the recording of the session, as well as all the other wonderful resources will be sent to you in a follow-up email. And don't forget to check out the Foundational Community Supports newsletter for everything happening within Foundational Community Supports. You are all very, very welcome. And with that, I'm going to stop the recording. And